Good afternoon, good morning, good evening, wherever you are joining us from today. Welcome to today's City Health Talk. My name is Joe Jewell and I'm the Director of Cities for Better Health. Cities for Better Health is a global program hosted by Novo Nordisk, working across more than 50 cities for the prevention of serious chronic diseases. We're present in every corner of the earth, and in today's webinar, we will have a chance to focus in on some of the initiatives that we're running through our Childhood Obesity Prevention Initiative with a focus on Canada and South Africa. The reason we focus on cities through our Cities for Better Health work is that cities are working to tackle complex health challenges on the ground, from rising rates of childhood obesity to unequal access to healthy food and opportunities for physical activity. What we find in our work on urban health is that these challenges don't actually sit with one setting, they don't sit with one organization or department. In fact, the drivers of these challenges and the solution to these challenges sit across different settings, sit across different sectors. They span the school setting, they require work from a public health sector, they require engagement from urban planning, but also community organizations and civil society. So that is why we find throughout all of the work that we do in Cities for Better Health that we need cross-sector collaboration. It is essential to ensure that the actions across settings can actually get off the ground and drive lasting impact for children and well-being. So today we're actually going to focus in on what coalitions can do to ensure that collaboration happens in practice. How are coalitions on the ground bringing together the partners across these different settings that are required to improve children's health? As I mentioned, we'll have examples from Canada and South Africa. So we'll specifically hear from Mississauga and also Johannesburg, South Africa, which are two of the cities that are participating in the Cities for Better Health Childhood Obesity Prevention Initiative, which we kicked off a couple of years ago. Before we begin, please just write your name in the chat, say where you're joining us from today, and say one of the things that you're looking forward to get out of this webinar. Please also remember to post your questions in the chat box, in the question box throughout the webinar, because we'll have plenty of time at the end of the session to come to an open Q&A where we really want to hear from you and hear those questions that are burning at the top of your mind around how to build lasting and impactful coalitions. To help guide today's conversation, I'm really pleased to welcome my co-host, Romina Genovese, who is the Senior Project Lead at Delivery Associates. Romina has been so closely involved in the Cities for Better Health Childhood Obesity Prevention Initiative, particularly in the implementation on the ground and working with local stakeholders on the coalition building that is critical to make impact happen across cities. So Romina, it's really great to have you with us today and looking forward to your participation.
Thank you, Joe, for that lovely introduction. And thank you, everyone who's joining us online today. It means a lot to be here to talk about such an important topic for global health. We'll also hear from experts on the ground who have built coalitions themselves. Joining us from Mississauga, Canada, is Tammy Schubert, the Chief Strategy Officer at OFIA. OFIA is a local implementation partner at Mississauga, Canada, and is also the key organization building coalitions on the ground.
And joining us from Johannesburg is Kamo Mako, who is the Health Equity and Sustainability Manager at Novo Nordisk, South Africa. Kamo oversees the implementation of the Childhood Obesity Prevention Initiative in Johannesburg, and she's working really closely with all the local partners across the city and the provincial health system to make it as impactful as possible. So thank you both for joining us today. I'm really excited about the conversation that we will have throughout the next hour. But before we dive into the practical and pragmatic experiences that both Kamo and Tammy bring to the conversation, we wanted to start by unpacking a little bit the concept of coalitions and coalition building as an approach to driving impact on urban health. So I want to start by asking you a question, Romina, about why coalition building is such an important model for delivering change on the ground and driving urban health.
That's a really good question, and I would like to start with the last part of your question on urban health. So traditionally, health challenges used to be solved in two separate spaces, either in doctors' offices or in hospitals. However, urban health challenges are a lot more complex than that. They need to be solved in all of the different spaces and environments that we as an urban community live in. And they need to encompass all of those areas. I like to see them like buildings, where you need different expertise to ensure that they are strong and that they're resilient. So for the coalitions that we currently have, we work on bringing partners together, so bringing actors together on shared problems and on shared common goals. And in this case, as Joe told us earlier, it's about preventing childhood obesity. So the partners that we work with are government and other public sector entities. We have academia, we have the private sector, we have schools, we have communities. And all of these partners are working together to make real change happen. As they achieve this goal and they engage more and more people in that common objective, what happens is that they become a lot more resilient and a lot more sustainable. What do we mean by sustainability? We mean that they survive leadership changes, they survive any funding cuts, and they also survive any institutional and political changes. So Joe, going back to your question on why coalitions matter, there's two main reasons. One, they cover all of the different spaces, the different environments that are needed to solve those problems. And secondly, they ensure that that change is maintained on the ground.
Super. I mean, so I think also one of the points that I took away from that is that coalitions really help us to address the complexity of today's health challenges. So the fact that the drivers of health today are actual social drivers, that they are embedded in different parts of society, economic systems, social systems, school systems, etc., and that you require these coalitions in order to bring together all the stakeholders that are relevant and have the solutions at hand. I also love the analogy of building healthy cities. So taking a building as an analogy is super important because basically it helps build the culture of health in the city. But I guess the idea of having a coalition is nice, but the devil is in the detail. And how do we make sure that coalitions actually move from alignment, so just bringing the stakeholders around the table, to actually enabling action to happen?
Exactly. So from my experience, there's three key things that allow coalitions to move from that alignment to action. First, they need to be designed intentionally. Secondly, they need to have a backbone function, a central team supporting them. And thirdly, they need to be seen as something continuous. I'll go into each one of those in a bit more detail. So the first one, for them to be designed intentionally, as we were talking about all of the different drivers and we were talking about the different spaces, it means that we're bringing together partners with different complementary skill sets. So we have the right people with the right expertise, the right experiences. However, they need to be doing the right things. And that is about the design of how you design that coalition. Secondly, coalitions take a lot of effort. They take effort to play that brokerage role. They take effort to guide everyone towards action. They take coordination effort. They take effort to solve the problems together. And for all of that to happen in a seamless manner that will not overburden the whole coalition, having a backbone function or a central team is key. And thirdly, and in my experience, the most common thing that happens is that a lot of people see coalition building as something that happens just once, something that happens either at the beginning of the project, in the project kickoff, and then it's not maintained or is not kept throughout all of the other project or initiative phases. So it is quite important to think about coalition building as something that is continuous, for you to continuously do as you build that initiative, so that the coalitions are not only built, but they're strengthened over time.
Super. I mean, a lot to unpack there as well from the examples that you gave. But one of the things that I took away is this intentionality when it comes to coalition building, so that you're setting clear objectives of the coalition, like what are we convening around and what are we intending to achieve. But you're also leveraging the complementary skills and comparative advantages of the different stakeholders. What exactly do each of the stakeholders bring to the table, and how do we collectively make a greater impact because of that? I really also like the backbone concept, which is an image of a swan came to my mind, which is, in an ideal situation, the coalition is moving forward in a calm way towards an end goal, but underneath the water, the swan is kicking very hard because there's a lot of work that goes into a coalition building. Let's not underestimate that. And I think a lot of these things are actually what we're trying to achieve in the Childhood Obesity Prevention Initiative. So we recognize from the outset that this is something that is going to require work across sector. It's going to require work at different levels of society in the cities. And so this is something that we've intentionally tried to do from the outset, and hopefully during the rest of the webinar today and the examples that you have from Tammy and Camo, you will get some examples. But very, very briefly, what is the Childhood Obesity Prevention Initiative? initiative that we are driving from Cities for Better Health together with all our local partners. So it is an initiative that we are running simultaneously across 6 cities. It's a multi-year project with a goal of driving better health and well-being for children, particularly children from underserved communities. We recognize that it is multi-stakeholder, multi-sector, so that is also built into the model. We also want, it's no one intervention is going to solve some of the challenges that the cities are working with. So from the outset, we also intended to have multiple interventions addressing multiple drivers of health, operating at the individual, family, school, and community level settings. The intention here is to drive a culture of health in the city, leverage all the assets that the city has, and see what we can achieve together through rigorous monitoring and evaluation also, to say what are the insights that we're learning, what are we seeing in terms of improved behaviors, improved mental health and well-being amongst the children, and how can we take that to inspire scaling at the city, region, or potentially also country level. One of the nice things around having a cohort of 6 cities moving together in tandem is that we can learn across as well. So how we can have learning exchanges across the different cities. So the conversation that we will be having here today with Tammy and Camo is an example, just in a webinar format, of a conversation that we're trying to have throughout the process and the timeline of the Childhood Obesity Prevention Initiative. But before we move into a discussion with Tammy and Camo, I would like to have a short video where we will actually look at some of the elements of coalition building that we would like to explore in our discussion today. So please enjoy the video.
It often starts with a simple question. Why are so many children in this neighborhood struggling to eat well or stay active? Local leaders, such as teachers, community groups, health experts, and city officials, begin to compare notes. The pattern becomes clear. The challenge is bigger than any one group. So they decide to work together. A coalition begins to form. But bringing partners into the room is only the beginning. The real challenge is building a coalition that lasts. So what helps coalitions last? It starts with trust. Coalitions work best when they invest in building relationships and open communication from the start. As trust grows, coalitions develop a shared sense of ownership. They are strongest when partners see the work as a shared project, not someone else's program. To sustain ownership, coalitions need accountability. Clear roles, shared plans, and formal governance structures help partners stay aligned and move forward. When these elements come together, coalitions grow stronger and more adaptable. Because strong coalitions are not built by chance. They are built with intent and designed to last.
So I hope you also saw from that video, which was a short video, but actually it really re-emphasized or underlined some of the points that Romina had been making in our introductory section around the fact that coalitions are important, but coalition building requires intent and purposeful work to make sure it's as successful as possible. And of course, local ownership and local participation in the coalition is important on the ground, so that everybody has a common sense of purpose and a common recognition of the goals to which they're working. So I actually want to start by bringing in Tammy into this conversation. And Tammy, as just a reminder, is coming from the work on the ground in Mississauga. And Tammy works for an organization called AFIA, who is leading the coalition building together with local community and partners in Mississauga. So Tammy, perhaps you could just take us through some of the background to the coalition in Mississauga. Like, how did it come together and what partners were involved and why?
For sure. Really what we did at the outset is we assessed the landscape, and we invited the partners that were, I would say, most immediately connected to or influencing the systems that impact physical activity and access to nourishing foods in Mississauga. And we kind of looked at it from the perspective of like before, during, and after the school day as that time frame that was kind of important to us. So in our case, what emerged was that the school board the city or the municipality and public health were, I would say, the most influential or biggest key partners that had responsibility in the key systems that influenced those health areas. And in order to initiate that, we reached out to the most senior level decision makers within each of those organizations. And that was intentional because it was really important for us to garner buy-in and make obvious connections to the highest level priorities each of those organizations already had. So whether that was something like a school board's multi-year strategic plan or the public health standards or municipal commitments or strategies, we tried to draw upon those threads to bring senior level decision makers to the table to engage them in the coalition level work.
Thanks, Tammy. So what we've heard from you, and is quite important, is engaging leadership and senior level officials. And in Johannesburg, we've had a similar situation. However, Johannesburg comes from a different context where it was already a CBH city. There were already some things happening on the ground. So Kamo, could you tell us a bit more how that coalition has come together there?
Sure. So, as you rightfully say, Johannesburg was already a long-standing city or City for Better Health program. And really, when COPI was presented to Johannesburg, we really leaned into the long-standing partnerships that we already had with the city of Johannesburg. This was formalized back in 2016, and we also then leaned into the partnership that we had just started to expand into with the Gauteng Department of Health, which is the provincial government arm of the health department. And we really wanted to leverage these two partnerships to create a strong institutional foundation, background, but also historical knowledge of, a shared vision towards healthy cities across the board. Then once we kind of discovered or kind of understood at a greater level that we needed to work in schools, we then decided to partner with the Department of Education, which is responsible for primary schools, for all public primary schools in the province and in the country. And they were identified as a key stakeholder and formally introduced as a partner. We also then went into, a program where we held an activation week back in, about a year ago to kind of assess the landscape of who else can we work with outside of government structures, who are the players in the field, and that then began the process of where we find ourselves in the current coalition today.
So Kamo, you've shared with us all of these different organizations that you've partnered with, from government and the Department of Education, as you shared, with all of the other organizations. Tammy, looking at all of the partners that you have involved in Mississauga with the coalition, why was it important to bring all of these different organizations together?
In the case of Mississauga, we felt these were the most influential partners that were connected to the largest systems that we felt maybe needed to work a little bit differently together. But these are also the systems that will remain in this community long after this project is done. So from the outset, we thought if we could shift the way these systems worked together and wrapped around children in school communities, we know that there would have been at least some element of built-in sustainability simply by having these folks at the table. To some degree, a lot of the solutions that we were seeking to potentially implement also needed to be built into or within existing infrastructure. And Joe mentioned that when he was speaking earlier. But for example, like one of the interventions we're seeking to implement in Mississauga is tied to physical activity equipment lending libraries. And so one of the most obvious solutions to lending libraries is to tie into the existing municipal library system. So the library that lends books. And so we're building upon an asset, for example, that the city already has. And they already have a pre-existing lending system through library cards, and they have physical buildings where people go to access and return things. So essentially, we're enhancing an existing municipal system that is heavily accessed by precisely the population that we're seeking to serve. So that's just one example of why, these partners that are anchored in this community and that have facilities and buildings and infrastructure that people are going to and accessing on a regular basis are the most obvious and logical, key coalition members.
That's super interesting, Tammy, and I think it also links into some of the points that Romina was making in the introduction around being intentional around which are the organizations that have an influence on the drivers of health, and how do you connect to the systems that are, either having a positive contribution on health, or potentially currently undermining health, and how do we actually shift those systems to be enablers of health? So that's really interesting for people to think through about when thinking of coalitions. And of course, what came out really strongly in what you just said, Tammy, was the importance of sustainability. So not to create parallel programs, not to create parallel systems, but to think about which systems are in place that could be tweaked and leveraged as platforms for health, using the assets that are there already that can be built on, expanded, transformed to be slightly different. So, I mean, there's some really nice insights coming out there. Camo, in the setting like Johannesburg, does it resonate what Tammy was saying? And how do you need to think about the partners and departments to involve in a complex system like Johannesburg?
Yeah, thanks, Joe. So very much similar to Mississauga in this regard, where it is important, or it was really important, to not try to reinvent the wheel. Plugging into existing systems and existing frameworks was very, very important for us. Like in the example I made, once we figured out we'd have to work with the Department of Education, we then needed to find out who exactly in the Department of Education we needed to work with. You can imagine every government department has different kind of responsibilities within each of its structures. And, finding out, or kind of knowing we needed to work with the National School Feeding Program. That was one of the important things. And then finding those particular individuals who would then form part of the day-to-day running of how we then implement ultimately. Also with our other partners, particularly our physical activity implementation partner, they're an existing partner to government. So again, leveraging off of existing networks and partnerships, very, very important for us in South Africa, because it's a very crowded space in some instances. And it's very important to not try to come up with something new, because you won't get buy-in with the people who actually matter, the decision makers, the gatekeepers. So I think for us, we've been quite lucky in the sense of finding partners who already have existing networks themselves, are familiar with the neighborhood in which COPI at a local level is being rolled out. And that goes a long way in information sharing and guiding how we implement the different interventions.
Thanks, Camo. What we have heard from you as well, and it's quite important, is to bring those partners that already have familiarity, especially with the communities. And in a lot of the other cities that we have worked with, one of the things that we have observed is that a lot of the partners, so the departments, the different partners in the coalition and actors that work together, they also worked in silos before. This is the first time that all of them come together. I know in Mississauga this has happened, right? So it's the first time that they have all of them together come to with that shared goal. So we would like to hear a bit more from Tammy on what has helped Mississauga, the partners there, to start working effectively together.
I think there are a few key ingredients that maybe helped catalyze this a little bit differently. I think one of the elements is that there needed to be a bit of a facilitator that was maybe external to some of the existing systems and structures, like our organization, to act as a bit of a catalyst to bring folks together around this project. But what I want to say is these partners all, in some way, shape, or form, had worked together before, maybe not all together, and with varying degrees of success. I think there had been some issues and some challenges, and maybe catalyzing some of those relationships in a more formalized and concrete way over time. And so I think this project acted as a bit of a driver, and it motivated players differently to think differently about how might we really break down the silos, begin to remove things like the red tape associated with collaboration across systems, and really move us to a different place of relationship and partnership. So in some ways, this project and our organization played a role in helping us bridge or break down some of the silos that existed between education, public health, and the municipality that come up when people are trying to work collaboratively. I think a couple of maybe other concrete things that were really helpful in our case were things that may sound fairly technical, but even just having a meeting mechanism. Like our coalition table needed a terms of reference. We needed to understand how we were going to work together, how we were going to make decisions, what assets did each of these key systems already have, and what were they bringing to the table? And then figuring out like what frequency or cadence do we need to meet to support things like co-design of interventions, and now things like monitoring the implementation of interventions and early data collection. So that really the establishment of the coalition right at the beginning of the project was critical to ensure ownership and buy-in of the work from all of these key systems really, really early on. From the get-go, each of these coalition members really had to see themselves in the broader project. They had to see their own priorities reflected. They had to see the leveraging points for some of their existing work. And most importantly, I think in our case, we were able to hive off human resources within each of these systems, specifically dedicated to advancing this project. So by this, I mean they were working on this project and also worked within their systems. And that's a really unique puzzle piece that I think enabled things to be unlocked a little bit differently in Mississauga.
Interesting. And one word I picked out there is coalitions as a catalyst for change. And I think, also in many cases, all of the actors who are brought in and the different stakeholders have the right motivation. They want to work, they're very motivated by the potential of health and the change that they want to see, but potentially in their day-to-day work, there are some barriers, there are some silos that are preventing them from working efficiently and effectively together. And maybe that is what the key role of a coalition in some instances is about, catalyzing that change, breaking down those silos and working in a different way, because perhaps the resources exist, but are just not being leveraged impactfully. I also took away, Tammy, that coalitions aren't always glamorous, right? What I heard you say there is that they have a sort of actually a day-to-day routine tasks and ways of working that make sure that work keeps happening. And sometimes an external facilitating role is quite helpful in that to make sure that the progress towards shared objectives is made. Camo, I wonder how this resonates in terms of what Tammy was saying from Mississauga, and what do you find helps partners work together effectively now that the coalition has been formed?
Yeah, almost mirror-like to Tammy's situation in Mississauga, where shared responsibility and a shared sense of ownership has gone a long way. It just at the very beginning stages of understanding the program and understanding its objectives and really what we want to achieve. But also with that, understanding how do you then pin the two or the varying kind of responsibilities to existing structures. So Tammy also highlighted that, working within existing objectives where human resources are concerned goes a long way in kind of establishing that buy-in. But we've also then found similarities in terms of, how do we work together, the ways of meeting, ways of communicating within the coalition. A lot of the really important school-facing officials are on the ground. They're not bound to their desks and laptops. So how do we communicate with them better? Is it through a WhatsApp message? Is it through a phone call? But also then having more formal structures in the form of like regular meetings, monthly meetings, and we're also trying to find ways to reconfigure the meetings that we do have to ensure effective but also impactful communications and running of the coalition. I think one of the exercises we are currently doing is we have a steering committee in Johannesburg that covers or represents the variety of stakeholders that we work with, Novo Nordisk, the government partners as well as implementation partners. And we really wanted to have a shared but also clear and consistent communications in terms of roles and responsibilities. Who is responsible for what? How do we make sure that even if we have shared networks and we know the same people, for the purposes of the project's success, how do we then have mechanisms in place? Who's responsible, who's accountable, who needs to be informed and who needs to be consulted? So those were conversations that are ongoing. But also at the very beginning were very important to have to understand that whilst this is a shared responsibility, not everybody has the same level of accountability or responsibility for various reasons.
Great. And it's really nice to see some common learnings and common observations coming through from this discussion. Do remember to submit your questions as we go along. I've already got some questions coming through, and there's some meaty ones, so our panelists should be prepared for some interesting questions that are coming up. But I'll take the opportunity now to move on to our second video, which is focused on some of the lessons learnt from the COPI coalitions in practice. So enjoy this second video.
In Johannesburg, South Africa, and Mississauga, Canada, partners in the Cities for Better Health Childhood Obesity Prevention Initiative, COPI, are working to improve children's health in underserved communities. Their experiences show that forming a coalition is only the beginning. The real challenge is turning partnerships into coordinated action. As the projects evolve, coalitions often need to revisit who is at the table. The right combination brings together partners with the authority to influence the systems the project aims to change.
Multiple stakeholders also creates a bit of a lag in terms of engagement sometimes. So it's been a lot of trial and error in terms of finding the right compilation of people to work with within the different government departments.
My key takeaways for building and sustaining a coalition are having a lot of flexibility of the composition of the coalition depending on the project's status and the project's needs.
Working across sectors also means navigating different institutional processes, priorities, and timelines.
So one of the major challenges with working with different sectors together is really navigating the unique approval processes within each partner organization and understanding the differences in organizational priorities.
What this project has enabled really is de-siloing many of these systems. And so part of the problem solving that we did there was really ensuring that we had folks within each of these systems being able to carve out in part some of their role to contribute to this project.
Over time, partners learn from each other's perspectives and experiences.
So what I found really unique with this is that everyone brings something different to the table, which has made our conversations richer and helps us see opportunities and challenges from many different angles.
Together, the experiences in Johannesburg and Mississauga show that coalitions must evolve over time. When coalitions are designed to remain flexible, break down silos across systems, and bring together diverse perspectives, they can help cities build healthier environments where children can thrive.
Super interesting to see some of the themes that we've already been talking about in the discussions emerge in that video as well. And I think one of the analogies or one of the examples was, sometimes it's easy to convene a coalition around an issue to just get it started, but actually getting it off the ground, making it translate into action and then maintaining it over time in a sustainable way can be the real heart of the challenge. So actually, I want to turn to you, Tammy, and ask around your experience in helping, or what you find helps the coalition in Mississauga stay engaged and maintain momentum over time. This is not an overnight solution, right? Building health in a community. So how do you keep the stakeholders engaged and drive towards the end goal?
For sure. To some degree, folks want to be engaged because they were involved in the co-design of the interventions from the very beginning. So I would say they're perhaps differently invested in the work than maybe if they were just sort of coming in a consultative way. In our case in Mississauga, it's part of people's roles to support advancing this work, both at an operational level, but also at an implementation level, like supporting intervention implementation. So because it's embedded in people's roles in a particular way, we actually have a bit of a different accountability mechanism to ensure that each player is contributing to advancing the broader goals of the project, but also more specifically how the project is embedded within their institutions. So whether that's in the school board, within the municipality, or in the region. So I think the way we were able to maybe move it from corner of desk for folks to center of desk means that it is part of their day-to-day doing to contribute to advancing the work of the coalition. So I think that makes it maybe a little bit unique. One more element I might raise is that really when we brought these players to the table and they continue to maintain momentum is because we kind of have the right health issue focus. And by that I mean, like, at the highest strategic level, each of these players actually fundamentally cares about the health outcomes that we're seeking to achieve for kids. And they actually have some of their own priorities tied to advancing that work. So they are invested in innovative solutions that will actually help them do their jobs more smoothly and better and achieve the objectives that they're seeking to achieve for kids.
Thanks, Tommy. That's super interesting. We hear some very interesting insights. So first, it's important to involve the coalition partners in the design, not only have them as consultative partners, but ensure that they're there throughout the whole process. And secondly, it's the alignment to the priorities of each one of these partners. That ensures that both their roles are aligned, but also that they're invested and they really want to solve that. So in South Africa, and Kamo, you can tell us a bit more about the experience there. There has been other approaches followed to ensure that the coalition stay engaged. And one of those was also in-person convening. So can you tell us a bit more about that?
Yes, so in South Africa, when we first started putting together the coalition, it was really, and I guess this goes across the board, where it was the post-COVID era of, we're going back to work, or it's in a hybrid format. And a lot of people were actually willing to meet in person as opposed to online. We also have, or at the time, we had specific challenges with, unstable power, availability in the country. And so connectivity and connecting over Teams or online platforms wasn't always best. But to foster, build, and also maintain strong partnerships, in-person meetings were very, very important. At this point, we still have quite a few virtual meetings that happen, but I can even share an example from this week where we had a partners meeting, and just seeing in the room the synergies, the energy in the room, and how it was easy to bounce off ideas and kind of then connect the dots to how do we then push forward? How do we work better? How do we iterate? How do we fix things? How do we, stop doing one thing that's not working? It goes a long way, because we're all, at the end of the day, people, and interpersonal relationships are very strong. But I guess really bringing the partners together from the beginning, whether it was kickoff meeting, activation week, or even, the different partner meetings and implementation partner meetings that we've been hosting, is really important, because again, it allows us an opportunity to clarify roles. You can ask questions in real time, but you can also then read body language to assess, okay, is this person following what I'm saying, or do they understand? And then you can also coax questions if you see a particular colleague who's very quiet. So I think that's quite important in terms of relationship building and just maintaining that level of connection across the different stakeholders, but particularly within the coalition.
I found it very powerful when you shared that we're all, at the end, people, right? So it's very important to continue investing on those relationships, ensuring that they're strong, ensuring that the partners feel comfortable with each other and understand each other. And from what I've heard from you, the in-person convenings are a way to ensure that that happens, and keeping them throughout time is also quite important to ensure that those coalitions are sustainable. Tammy, turning to you and wanting to hear a bit more about how you embedded those coalitions into already existing structures and systems that were happening in Mississauga.
Mm-hmm. I mean, if I think back to the beginning, when we were thinking about, which departments, for example, within the city will we need to reach out to? What types of roles within the school board will be important to help us advance this work a little bit differently? So we knew, for example, that the Department of Recreation within the city was going to be really important. They're responsible for all of the programming within community centers that's connected to physical activity. When we thought about the school board, we thought about things like, where are there roles within the school board that really hold a different responsibility in relation to student health and well-being? And so how could we reach out to the most senior people within these organizations, but then help us identify who, after that, within those organizations are we going to be working with over time, that are senior enough to act independently, but also be connected enough to the ground to understand what's going on, perhaps like within schools or within the community centers. So there was a delicate balance between, like, when we identified the specific human and what role they held within their organizations, that was a really important decision point. And as I mentioned, we carved out staff time within some of the positions within these systems, and so we worked back from co-created outcomes and sample outputs that we wanted folks in some of these roles to be able to do and achieve. And that helped folks within those systems and organizations craft role descriptions that could connect back to this project and this work. And then we set up structures to help us monitor the ways in which people from each of these organizations were contributing to the work over time. So we did, I want to say, formalize the ways in which we were, working with individuals within each of the organizations that were part of the coalition. The other thing I want to say is we also didn't pretend to know how well this was going to go or how it was going to play out over time. So we did and continue to make space to consult with the coalition members and more senior folks within those organizations to understand, like, how is this going for you as we continue to go along this journey together? What is the perceived progress for you and for us? How well engaged are you feeling? And how might we sort of continue this collaboration over time? So it's really iterative in nature, and as Kamo mentioned, it's a relationship that we have with people, and we need to sort of also have those informal touch points to check in and see how things are going.
I think what I'm also hearing, Tammy, from some of your reflections, including earlier, was around making sure that it was the right health focus for the community and the stakeholders, that they saw the challenge and they saw the health issues where they wanted to make progress in it, and that they are invested in it because it's in their strategies, in their priorities, and therefore I really liked your phrase, it moves from the corner of the desk to the center of the desk because they see themselves in it, they want to achieve. Kamo, in Johannesburg, similarly, I think you've also tried to link it to existing government programs so that the childhood obesity prevention work in Johannesburg is actually reinforcing, enabling progress towards the existing government programs. Why was that important? And can you put a few more words to that choice?
Yeah, so at the very onset, or maybe in the first year or so of us trying to put together the coalition, there was really a lot of pushback to particularly the word obesity. And that was mainly due to the fact that in South Africa, there's a triple burden, right? So there's overnutrition, there's undernutrition, and then there's just severe poverty. And how do you create a program, or how do you bring a program to this type of context that almost others the rest of the other issues facing children in the country, or facing the populations in the country? So localizing the name in a way that avoided the barrier of a common word such as obesity. It was very important to us. And again, to the point I made earlier of, leveraging existing structures. We then consulted, I think it was about a 3 or 4 months consultation process that went on, where there was different names and different suggestions put together. And then ultimately we landed up on the existing government program. And this is a program from the Provincial Department of Health, where it's called the Asibe Healthy Program. What that then means, it's a local Zulu word. So Asibe is a call to action, which means let's get healthy. And then we thought, but working in schools, and we really still want to highlight that this is a childhood kind of program that we're working with. And then we added the Josie kids to bring again, the essence of the city. Josie is a local way of saying Johannesburg. And again, localization is very important. It creates that shared ownership. It says the program is not just mine, it's ours. And it really fosters that wanting to take it up. And we've pressure tested this across multiple stakeholders. And when we got to that, even at the more senior political level within the province, it's an easy enough word or name of the program to remember, because it latches onto an existing program. I think it was Tammy who mentioned it earlier. When you make things, or when you bring along things that are part of the everyday lived experience of human beings, whether this is in their work capacity, it makes it easier for them to remember. So we also have district officials who are responsible for the different schools that we're working in. And once we moved and started using the new name, it was easier for them because it's in a local language. It's quick enough to say ASIBE and everybody knows what we're talking about, even without saying the full name. So we found that just even something as small as the localization of having an indigenous word made it a much, much easier, buy-in, even from the schools themselves and, external parties outside of the coalition, but internally with the coalition, it just made sense. And we had really great buy-in when we were doing that particular vote.
Thanks, Camo, and thanks for reminding us how important it is that even if this is a global program that spans around the world, it's still important to create that local identity for the program. Use the local words, use the local references, and ensure that people actually own it in each one of the communities where this program is happening. Tammy, I'd like to hear a bit more from you on incorporating and integrating the project within the system. So in Mississauga, what has happened is Mississauga has had dedicated staff working across the partners. So can you tell us a bit more about that role, how that role worked, and how it has supported both coalition building and sustaining that coalition over time?
For sure. If I were to use a bit of an analogy or a metaphor, I would use the metaphor of a mole. And so I feel like these folks that we've been able to have their roles specifically identified to supporting the coalition are almost like our little system navigators. And so within the school board, within public health, and within the city, I think they almost to some degree see it as their responsibility to make the appropriate connection, to open the doors, to break down the barriers, to identify connections, to figure out how to anchor interventions in ways that will long outlast this project and be sustained over time. These folks really know how to navigate their own bureaucracies and decision-making structures. And when a barrier does come up or a challenge does come up, because we have had so many tricky barriers and challenges to navigate, they kind of know who to go to or who to speak with or what process to pull on to be able to move through that challenge. And that has been indispensable for this project and for our ability to move through work. If I were to pull on another specific example, and I'll use the lending library, the physical activity equipment lending library example again. If we want to embed a lending library system within a municipality, I don't know who to speak to within libraries to make that happen. But our coalition member who works for the city does, right? And so she directly knows who to connect with to unlock this possibility across multiple libraries within Mississauga. And they're able to make that happen immediately without us as an external partner having to try to play a game of figuring out, well, who do I reach out to, and then possibly getting some sort of runaround and not being able to speak to the most senior enough person right off the bat. So I think it really, this idea of, like, I call them our moles or our little system navigators, but they're the people who really unlock the possibilities, and they're so critically important.
Super, and we're starting to see some really interesting questions coming through, so we'll keep this last question to you, Camo, relatively brief so we can get onto the questions from the audiences. But Tammy was just speaking around the role of people in the coalition who know how to solve things. Sometimes local champions can also help move the coalition forward. Do you have examples from South Africa of how those local champions have been helpful in the coalition?
Absolutely. I think sometimes within existing structures, there'll always be gatekeepers. And it's important to make friends with the gatekeepers and have them understand what you're trying to do and why you're trying to achieve it. I made mention to us having a steering committee at a local level, and this really, again, keeps us accountable, but it provides an opportunity to problem solve together. And through the steering committee, we have been able to then understand, okay, there's school-facing staff who it's their job to be in the schools. It's their job to know what's happening in this particular region. And then we bring those in when we go into the schools with our implementation partners. They are part of the meetings. They facilitate the meetings with school governing bodies, with school management teams as well, to say, okay, there is this program that we'd like to roll out in your school. It has been approved at, all the levels that require approval. We just need you to make it easy for them to come and roll out this program. So having that type of insight into the schools also allows for them to provide guidance, to say that's not going to work in the school, or we can't say this in the school, or maybe we need to approach it in a different way. So very briefly, local champions play a big role in progressing the everyday running of the program.
Thank you so much. That was possibly the most positive framing of the word gatekeeper that I have heard, but it's great how to make those gatekeepers champions for the program. We have roughly 9 minutes left, and so maybe we can do some rapid answers to these questions that are coming in. A number of themes are coming out in the questions. One is around how to involve and anchor the coalition work in community, in the needs of the community. So I'll come to you on that question in a minute. There's something around choosing the right coalition partners. How do you make sure that there are those that are necessary versus those that are perhaps have the greatest potential to bring innovation? And then another question comes in about, like, what do you do if you have some challenging coalition members? Like, how do you manage more difficult coalition members? If you have any reflections around that, maybe not specifically in this coalition, but in previous work. So perhaps, Tammy, I can come to you with the first question around anchoring the purpose of the coalition and the project in community needs, and making sure that the voice of community is actually represented.
Yeah, absolutely. And I think in the case of Mississauga, it really, there was a really extensive co-design process, not just at a coalition level, but at a community level, right? So I would almost see the coalition perhaps as sitting at a slightly higher level, but within each school community and neighborhood where we were undertaking work, we went through extensive co-design, and each school, in fact, has their own, not coalition, but I'll call it a school team that is made up of school and community members that have, like, I would say, almost like an even more hyper local perspective on what is going on within each of those school communities and neighborhoods. So two pieces here to answer that. I would say co-design every step of the way. And I mean that in the most authentic way. I don't just mean sort of like ad hoc consultation. I mean community members at the most on the ground level being truly involved. I think where the coalition connects to that is those coalition members were able to say, here are the places and spaces where the community members that maybe were reaching a little bit less, but this is where you could potentially find them. And these are ways in which you could potentially engage with them that will reach them where they're at. Because I think that is where maybe as an external organization, we didn't really have fully the pulse there.
Super. Camo, if I may shift topics to you then, around, like, how do you balance those that are necessary to have, those that have the greatest potential for innovation, and any tips for managing challenging coalition members? Feel free to answer the question the way you choose to answer the question.
I'll start with the easiest one, which is how to deal with difficult coalition members, surprisingly. I think, again, going back to what I said earlier, people are people. Everybody in the coalition has a day job, and they have other kind of competing priorities sometimes. So it's about understanding how to not be a burden, but also ensuring that they understand we are all here for a purpose, and reminding consistently, this is the purpose that, pulls us together. We are also trying to help each other progress forward, healthy cities and healthy children, and the bigger goal of, not having a sick nation 10, 20 years from now, if we can't make these small changes first. And then the formal question of how do you make sure you've got the right compilation of people? Again, consultation from the very beginning. We leaned on our existing relationships with different government departments and allowed them to guide us to say, okay, we need to bring this stakeholder in, we need to bring that stakeholder in. And then also expanding that. I mentioned earlier that we hosted an activation week where we brought in multiple stakeholders, different stakeholders from across the spectrum of, people who do this type of work. And having those conversations, but then also going down the list to saying, is it important to have this person, given they're at a very senior level, every day in the monthly meetings, or do we need to shift to have them becoming an informed member of the coalition versus a more consulted or responsible member of the coalition? So I think using even tools such as the RACI metrics, which kind of outlines who's responsible, who has authority, who's consulted, and who's informed, it does help to map out effectively, how to then run your coalition to the best of its abilities.
Okay, so I will come back to you both, Tammy and Camo, with the final question, which is, what would be the 3 keywords that summarize and represent best practice for coalition building in your experience? 3 keywords, if you had to choose 3, and that will be the final question for you. Romina, if you could briefly answer a final question as well. So working across with Delivery Associates, working across 6 cities, supporting coalitions, what would success look like from your broad perspective 5 or 10 years ahead? Of course, you're not necessarily on the ground everywhere, but taking a higher level view, if you could briefly answer that question, it would be great.
Should I start?
Yeah.
Great. So for both Delivery Associates and myself, I would say, the reason why we're engaging with this work and why it's so important is that we want it to outlive us. And by us, I mean outlive our support. So success would be for it to do that, for it to outlive our support, for it to outlive Novo Nordisk funding, for it to continue and maintain that change, not just for current generations, but also for future generations, so that the city continues building healthier and healthier, becomes a healthier city. If I can be more ambitious as well, not only for it to outlive us in that city, but also for it to inspire other cities and then be replicated in other cities. I think it would be great if each one of these ideas, each one of these interventions can also be taken by other cities, maybe within the same country, but also taken to other countries and ensure that those other countries are also preventing childhood obesity that way.
Super. Thank you so much, Romina. Camo, what are your 3 words in terms of key takeaways for coalition building?
My 3 words are partnership, communication, and shared ownership. I think throughout the conversation this afternoon, we've kind of touched on this in various ways and why these are all important. But my takeaway really is having a shared goal. What this program has been able to do and what this coalition, hopes to do is to connect the dots, bringing together relevant stakeholders who have the expertise and allowing them to do what they do best in the spectrum of, what we are also trying to achieve has been quite a pleasure to be part of and an honor to be part of. So I think for me, having the right people, but also connecting the dots to a shared problem across the globe that impacts various issues, whether health, whether education, and at a broader societal level. So yeah, that's for me.
Thank you. And Tammy, your 3 words.
My 3 words would be co-design, trust, and flexibility. I say co-design because the folks that are closest to the problems are also closest to the solutions. I say trust because you can only ever move at the pace of trust. So it is so critically important to remind ourselves that we are working with humans and people who have their own issues and problems, as Camo mentioned before. And then flexibility because it never really goes as planned. And so our ability to be flexible and adaptable to the changes that come up in the environment and be able to work collaboratively to work through them is so critically important.
Amazing. Wow, what a rich conversation that we've had today. So many insights from the ground, so many insights from organizations working across cities. And I really hope you did enjoy it as much as we have. So that does bring us to the end of today's City Health Talk. I think what we took away, or at least what I took away from it, is that building coalitions is not simple, but it's essential to deliver impact on the ground, to anchor it in community, and to make change sustainable over the longer term. It's important to work across sectors, work across institutions and communities to align to local priorities and strategic objectives. But with coalitions, you can move beyond the isolated actions and create lasting improvements for children's health. So thank you to Camo, Tammy and Romina for joining me today in this City Health Talk. If you'd like to explore the ideas further, do look at our website, citiesforbetterhealth.com, where we actually have a new publication called Building Blocks for Better Health, which is focused, the first chapter of that, or the first edition of that series is actually focused on coalition building. So do visit our website to see and read about more examples of coalition building as part of the Cities for Better Health project. We really look forward to continuing the conversation with you today. Thanks for all the questions that came through. We will follow up, keep the conversation going. But in the meantime, we look forward to seeing you at our next City Health Talk, which we'll be advertising in the coming weeks and months. Thanks so much and have a great rest of your day, and see you again soon.